Welcome back from that kind of the short break. We are continuing with this session where we are going to be looking on the ECG waves, especially being recorded on what we call using the lead 2, because we said lead 2 gives us a clear wave pattern on the ECG paper. So now this one here is going to be now my ECG paper, okay, where our wave pattern is going to be drawn. And then this one is going to be now our lead 2. We said that our positive electrode is going to be put on the left leg, and our negative electrode is going to be put on what we call the right arm. So now this kind of the lead is going to be looking at the heart on the inferior kind of the view. You're going to be looking at the heart on this kind of the view, which is our lead 2. Okay, and we said that lead 2 gives us a clear wave pattern on the ECG paper on a normal human being. Okay, so let's go ahead and get started. So now we want to be measuring the electrical activities, how they are going to be moving throughout the heart, and then how they are going to be illustrated on our ECG paper. Now, we said that the heart has that intrinsic ability to spontaneously depolarize, sending those kind of reaction potentials down the entire myocardium, causing what we call contraction on its own without any external effect. And that one is what we termed as the automaticity. And we said who was generating the automaticity? It was the SA node. And where is the SA node located? The SA node is going to be located on the right atrium, preferably on the entrance of what we call the superior vena cava. That's where we're going to be having our sinoarterial node. Now, throughout the entire of this study, you should be remembering the following terminologies as we looked at in the previous video. We need to remember what a vector is. We need to remember what is a positive deflection. We need to remember what is a negative deflection. And we also need to remember what is an isoelectric line. Because you're going to be using those kind of the terminologies during the study of what we call the wave formation on our ECG paper. Okay, so let's go ahead and get started. So now we want first pretend for a minute that now our SA node is going to be now firing. When it fires, it's going to be now spreading those kind of the action potentials. And those kind of the action potentials are going to be now spreading on what we call the left atrium and what we call the right atrium. And we said that on the left atrium is going to be through what we call the Backerman's bundle, and then on the right atrium is going to be what we call the internodal pathways. Now the question is, this kind of the depolarization is going to be moving from the SA node, moving towards what we call the left atrium, and even also moving towards what we call the right atrium. Now, this kind of the depolarization, we want to be looking at its direction, where it's going to be pointing, and this one will also help us to generate what we call a vector. Now, when you see the SA node and it fires, this kind of the action potential, this kind of the depolarization is going to be moving in this kind of the way. So now, if I can create my vector here, this is going to be the direction of my vector. Okay, this is going to be the direction of my vector. Okay. Now, when you see on the direction of this vector, you are realizing that the depolarization is moving away from the negative electrode and it is facing towards the positive electrode. So now, what does the principle of the galvanometer say? It says that whenever the positive charges or whenever the depolarization is moving away from a negative electrode towards a positive electrode, that kind of the deflection is going to be a positive deflection. So now our ECG machine is going to be having what we call a positive, deflection. Okay, so now this kind of deflection here is what we call our P wave, and this P wave is going to be denoting what we call atrial depolarization. It is such another beautiful thing. Okay. Now, when the depolarization spreads throughout the entire kind of the atrium, they're also going to be causing them to contract to push the blood down. Now, this kind of depolarization, it does not cross from the left atrium down to the ventricles on these sides. Okay, it has, some of them are going to be dying out on these corners, but some majority are going to be converging, and then they come on this specific type of the nodal cell, which we call the atrioventricular node. Now, this atrioventricular node is a slow conductor. What do I mean by this? He has the potential to hold this kind of the depolarization, this kind of the action potentials for approximately 0.1 second. It can delay these kind of reaction potentials for approximately 0.1 second. The fact that this AV node is holding this kind of the depolarization for approximately 0.1 second, it means there is not going to be any kind of the movement of the action potentials within this time. Now, if there is not any kind of the movement of the action potentials because they have been held by what we call the AV node, will there be any kind of the deflection to be noted on our ECG paper? There is not going to be any kind of deflection, and for that reason, our pointer is going to be coming back, to the neutral, and then to have this kind of isoelectric line. Now, this kind of the isoelectric line, it notes that this is the small period during which the action potentials are held on what we call the AV node. Okay? Now, our AV node is now going to be allowing the movement of what we call the action potentials. Now, when it allows what we call the action potential to cross down to what we call to the myocardium, first of all, it's going to be moving through what we call the bundle of His, from where the bundle of His are going to be now splitting into two. It's going splitting into what we call the left bundle branch and what we call the right bundle branch. All of them are going to be inside what we call the interventricular septum. Now, the question is, of these two right and then the left bundle branches, which one is going to be depolarizing the interventricular septum? The answer is the left bundle branch is the one responsible for the depolarization of what we call the interventricular septum. It is such another beautiful thing. So now the question is, what is the direction of the depolarization coming from what we call the left bundle branch to depolarize the entire kind of interventricular septum? The direction of what you call the depolarization is going to be in this kind of the direction. Okay, it's going to be in this kind of the direction. So now, if I can make a mean vector for this, is going to be like this. Okay, it's going to be like this. So now, when you see how the left bundle branch is going to be depolarizing the entire kind of the interventricular myocardium, this kind of the depolarization is going to be now moving towards what we call the negative electrode. It is moving away from the positive electrode and is moving towards what we call a negative electrode. Now, by the principle of the galvanometer, whenever positive charges move from the positive electrode towards a negative electrode, that one gives us a negative deflection. Okay? So now our ECG machine is going to be having what we call a negative deflection. Okay? So now this negative deflection is what we call our Q wave. Okay? So now we said that this one here is going to be our P wave. So now this one here is going to be our Q wave. Okay? Now that the whole entire interventricular septum is fully depolarized, now this kind of depolarization is now going to be moving down to what we call to the ventricles. Now the question is, how is the ventricles going to be getting depolarized? These kind of the Purkinje fibers are going to be deeply buried, more especially on what we call the deeper layers of what we call of the myocardium. Now, this kind of depolarization on what you call ventricles is going to be starting from the inner part going outwards. That's going to be the normal kind of the direction of what we call the depolarization. How is it going to be happening? This kind of depolarization is going to be moving in this kind of the manner. Okay, in this kind of the manner. Okay, you see how the depolarization is going to be moving. Okay, it's going to be moving like this. Of course, when we talk of depolarization, we are denoting the movement of the positive charges. So now it's going to be moving from inside going outwards. So now, if I can create a vector for the case of what we call the left ventricle, we said that the thickness of the myocardium determines the size of the vector, meaning that the vector which is going to be produced by the left ventricle is not going to be the same as the vector produced by what we call the right ventricle. So now, if this is going to be the vector, of what we call the left ventricle, this one here is going to be slightly a bit smaller. Okay, it's going to be slightly a bit smaller because the thickness of the myocardium on the right ventricle is going to be smaller compared to what we call the left ventricle. So now, if I can get a mean kind of the vector, I combine all these kind of the vector, I'm going to be getting this kind of the vector, which is going to be like this. Okay, which is going to be like this. Now, this vector is going to be a bit bigger. Okay, and the fact that is a bit bigger and is facing from negative electrode is facing towards a positive electrode. And by the principle of the galvanometer, our kind of the pointer is going to be giving us a positive deflection. By the fact that this kind of the amplitude of what you call this kind of the vector is going to be a bit strong. For that reason, we are going to be having a very strong kind of the deflection upwards. Okay. So now, this kind of the strong kind of the amplitude of deflection denotes that the vector which was created was a bit stronger compared to other kind of the vectors which have been forming. So now, this kind of the wave which has been formed, this wave here is what we call our R wave. Okay. Now, the question is, we have now depolarized what you call the apex of what you call the right and then the left ventricle. We have not yet depolarized what you call the base of the ventricles. We also need to depolarize the base of the ventricles because they are going to be depolarizing last. So now, how is depolarization going to be happening on what you call the base of the ventricles? These are going to be the base of the ventricles. Okay, these are going to be the base of the ventricles. Now, what is very, very much funny is that the depolarization of the base of the ventricles is going to be somehow a bit unique. So now, this is how the depolarization is going to be moving. Okay, the depolarization is going to be moving like this. So now, this kind of the depolarization is going to be trying to face in this kind of the direction. Okay, it's going to be facing a bit in this kind of the direction. Now, this kind of the direction is going to be moving away from the positive electrode and is trying to move a bit towards the negative electrode. And by the principle of the galvanometer, whenever positive charges move away from the positive electrode towards a negative electrode, what's going to be the direction of the deflection? This is going to be giving us a negative deflection. For that reason, the depolarization of the basal areas of the ventricles are giving us a negative deflection. For that reason, you're going to be having what we call a negative deflection. Okay, and this negative deflection is as a result of what you call depolarization of the base of the ventricles. Okay, and this kind of the wave is what we call our AC wave. Okay, it is such another a beautiful thing. So now we have now fully depolarized the entire ventricular myocardium. In the previous video, we said that whenever a piece of the myocardium is fully depolarized, our deflection pointer comes back to the neutral. Now, the same is going to be happening here. Now, our entire ventricular myocardium is fully depolarized. Shall we have any change in the membrane potential? At this time, the whole of this area is positively charged. For that reason, our pointer is going to be coming back on what we call to the neutral position. So now our pointer is going to be coming back to the neutral position and it's going to be giving us this kind of isoelectric line. And this kind of the isoelectric line is denoting that the entire ventricular myocardium is now fully depolarized. Okay? Now that we have seen that the whole depolarization process has taken place, now the heart is going to be now contracting and it pushes the blood off the ventricle. But of course, a contraction wave is going to be followed by a relaxation phase. And the relaxation phase is going to be now a repolarization phase. Okay? So now we're going to be having what you call ventricular repolarization. So now we said that repolarization means that now the cells are going to be now losing potassium ions. And whenever they are losing potassium ions, they are now starting to regain their electronegativity. Okay? So now, what's going to be happening? Here is what's going to be happening on what you call the repolarization of what you call the ventricular myocardium. The areas that got depolarized the last, it is the area which is going to be starting in the process of repolarization. We said that depolarization was moving from in going out. It means that the outer areas of the ventricular myocardium was depolarizing last. This is the area which is going to be repolarizing first. Okay, this is going to be the area which is going to be repolarizing first, meaning that our repolarization is going to be starting from this side. So now we're going to be now, and the repolarization is going to be aiming at washing positive charges. Okay, So now it's going to be moving in this way. So now even also this area also gets repolarized. Okay, and even also this one also gets repolarized. Okay, so now this process is now going to be happening throughout the entire ventricular myocardium. Now when you see the movement of this kind of the repolarization, is going to be moving from the outer areas of ventricular myocardium, moving in that kind of the direction. So now this is going to be now the direction of what we call the repolarization process. So now if I can create a vector, here, it means our vector of repolarization is going to be facing that side. And to be even more specific, this is going to be a repolarization vector. And even also this kind of the ventricular myocardium on the right side is also going to be repolarization like this. Okay. Now when you see this direction of the repolarization, it is moving from the outer areas of the ventricular myocardium and is facing towards what you call a negative electrode, meaning that the negative ions are moving from a positive electrode and they are facing towards what you call a negative electrode. By the principle of the galvanometer, it says that whenever negative ions are moving from a positive electrode towards a negative electrode, it also gives us a positive deflection. And even also, whenever positive charges are moving towards the positive electrode, it also gives us a positive deflection. So now our pointer is going to be giving us a positive, okay, a positive, and this positive is going to be our T wave. And this T wave is going to be denoting what we call ventricular repolarization, because the ventricles are now coming back to the relaxation phase. Okay. So now, to finish it all, we are going to be now making a very quick summary of the meaning of all these waves. We said that this kind of the P wave is going to be denoting what we call atrial bipolar, what we call atrial depolarization. Okay, the atrium are depolarizing. Now, we said that this Q wave was following what you call septal depolarization. Okay, so now our Q wave, our Q wave was denoting what we call septal depolarization. Okay, such a beautiful thing. So now, from the Q wave, we moved to the R wave. And this R wave was denoting major ventricular depolarization. The bigger parts of what you call of the ventricles, we are getting depolarized. So now this kind of the R wave was denoting major ventricular, depolar, depolar depolarization. Okay, major ventricular depolarization. Okay, and then we moved to what we call to the S wave. Okay, when we moved to the S wave, we said that this one was mainly focusing on what we call basal ventricular depolarization, the base of what we call of the ventricles. Okay, so now this one was mainly focusing on what we call ventricular ventricular depolarization. Depolarization. And then lastly, when we see on the T wave, when you look on the T wave, this T wave is going to be denoting what we call ventricular repolarization. Okay, it's going to be denoting what we call ventricular repolarization. Okay, it's denoting what we call ventricular repolarization. And of course, when you see this QRS, it makes what we call a complex. Okay, and this complex of the QRS denotes mainly what we call ventricular depolarization. You may be finding very many books writing it as QRS complex. Okay, QRS complex. This one is going to be denoting mainly what we call depolar, depolarization. Okay. Thank you very much for watching. And if you think whatever I've talked is making sense, is really adding to your benefiting, please, you can hit like button, comment down in the comment section, and please subscribe. As always, to TUMNAD, until we meet next time.